The truth is that the first year of Obamacare implementation in California and in the United States was rocky, and its effects on patients were inconsistent and uneven. As I said, some people have benefited greatly. Dr. Pan and Dr. Thorpe both brought up, and the columnists when I talked to them before this the panelists before I talked to them before this panel, all brought up the big thing, which is that you can no longer be denied based on your health condition. That's a huge impact and benefit for people. Other people are saving hundreds or perhaps even thousands of dollars a month or year on their health care premiums because they qualify for federal tax credits, which reduce the amount they pay out of pocket. Let's just look at the numbers too for some successes. More than 7 million people across the country are enrolled in marketplace health plans. And Californians make up more than 1 million, or more than a seventh of those who are enrolled in Covered California, which is our health insurance marketplace. Out of those 1.12 million, nearly 90% qualified for tax credits. Let's not forget the Medicaid expansion, which I think is a big undercovered thing in this ACA implementation. California, again, leads in the numbers. At least 2.5 million Californians are newly enrolled in Medi-Cal, which is our version of Medicaid, since January 1st of this year. At the same time, as the doctors before me have mentioned, there have been major challenges for consumers. The faulty Covered California and healthcare.gov websites continue to pose challenges for consumers to this day. However, things are definitely better than they were the first time around. The Medi-Cal application backlog in California still persists, and there are lawsuits over this. Covered California have canceled people's plans over the course of the year without their knowledge or their consent. Translation issues for people who don't speak English as their primary language. And perhaps consumers' biggest complaints revolved around provider narrow networks and provider access.